I'm Dr. Valerie Andersen, a licensed psychologist and the clinical director here at Coalition Recovery. I wanted to take a couple minutes and just run down in terms of what it is that we do, and then the people we treat, and kind of what our treatment program looks like. So if you're taking the time to watch this video, there's probably a good chance that yourself or someone you know might be struggling with substance use or mental illness, or maybe both. I know that it can be very overwhelming to surf the web and trying to find treatment centers that might meet your needs. So, like I said, I just want to touch on some points that would be important for you to spend time looking at so that you can make the right decision in terms of what treatment would be best for you. So, there's four main aspects that I think would be really important for people to really look at so that you can gauge the difference between treatment centers, one to the next. So the first is really, what is it that they treat? So we are a dual diagnosis treatment center, meaning that we treat both substance use and mental illness concurrently, so that not only one part of your the issues that you're struggling with are focused on. And as it stands right now, research really shows that 50% of those with mental illness struggle also with substance use, and then concurrently those that abuse substances also tend to have mental illness. So it's really important that you would look for a treatment center that would serve both of those needs. The second question is really, what is the programming like? What is it that I'm going to learn here, and are my needs going to be met appropriately? So our program here consists of between 20 and 25 weeks of curriculum. Each week is very individualized and looks at aspects that clients tend to really struggle with while in active addiction, or skills they may have lost completely. So some of the themes that we touch on each week include things like communication, shame resilience, family dynamics involved with substance use and mental illness, and things of that nature. So each week is different. Also, we have a team of clinicians that have specialties in different areas of treatment and the therapeutic approaches that they take. We have clinicians that really will look at dialectical behavior, some that will utilize motivational interviewing, some kind of touch on CBT, which is cognitive behavioral therapy, and some really look at the underlying issues that deal with depression, anxiety, and those type things that feed into and sometimes promote substance use. So I personally am certified in accelerated resolution therapy, or ART, as well as applied positive psychology. So ART is a trauma-based therapy that is very, like its name suggests, accelerated, and it works with out-processing images and physiological responses that one would have when they have traumatic pasts and experiences that they tend to keep struggling with on a day-to-day basis. This therapy is effective, and it is research-based and can resolve trauma in as little as 2 sessions, being an hour each. So it's very robust. It's something that really caters to those coming in with trauma. Nearly 65% of people that come in to substance use treatment have a history of trauma, so it's very important. Applied positive psychology is something that I'm very proud of. I got certified about 7 or 8 years ago in Texas, and it is an approach that takes a very different view of how to treat substance use and mental illness, in that it looks to when times were going very well and trying to aim back towards those instead of focusing on all of the things that went wrong. So instead of kind of going from bad to good, we look at going from good to great, and focusing on character strengths instead of character defects. So that's the second aspect. The third, really asking yourself, how many people will be in treatment with me? The capacity is really important when looking at a treatment center. A lot of the larger treatment facilities, clients tend to become a number, and that's not the case here. We maintain a lower census so that treatment can be individualized and clients get a safe, intimate environment in which to share and connect with their community members. So that's an important thing to remember when searching for treatment. The last thing is really the culture. What is the culture of this facility? What are their principles that they work from? So the culture here is pretty simplistic. We have 3 aspects that get broken down into some of the main issues that clients need to learn how to gain coping skills around. So our culture is really based off of own it, learn it, and live it. So what that really breaks down to mean is we lead by example as a team and full clinical staff with looking at accountability, courage, growth, and resiliency. So as simple as it may sound, those are 4 major strengths that if people can grasp and really learn, that they have a better chance of staying sober and living in a program of recovery on the outside. So that's my rundown on kind of what we do and questions that would be important for you to ask when you're looking for treatment. I appreciate your time and thanks for watching.